So, second part, no, actually third part of our Homeschool Your Healthcare program. And we are up to actual protocols. As soon as our girls show up, they will give you printouts of one of the basic, very basic, and in our opinion, very important protocol called ANS balancing, autonomic nervous system balancing. We will be reviewing right now a series of conditions that are most commonly met in our daily life, so we can together see what kind of equipment, protocols, and even simple advices we can use at home to better balance those conditions. Before we go any further, guys, let's start from the basics. Tell me, what is the most common condition that people, the most of humankind, suffer? Depression, migraine, insomnia, and all of that, including overweight, sprouts from one thing called chronic stress. Doesn't it? Chronic stress. So let's see how we deal with chronic stress, because chronic stress is said to be the reason of about 10,000 different diseases and about 100,000 different symptoms. And that's only according to the conventional medical statistics. If you scratch every disease or disorder, you will find the chronic stress somewhere in, well, we are not counting congenital diseases, and even they may have some kind of parental chronic stress in the basis of it. So let's look at the chronic stress and what we can do in order to balance that condition. Stress is an interesting phenomenon. Did you guys not realize that stress, when we say stress, we think something bad? But stress is not bad. Stress is our normal, very natural body's response to a certain factor from outside environment, which our system has difficulties to adapt to. We will be, in the next part of our presentation, we will be going through what we call adaptive reactions, or our activity that the body does in order to balance itself with the environment. It adapts to the environment. So it has certain types of standard reactions, how it adapts to the environment. And one of those reactions is stress. Stress is not a very adequate reaction of the body. Adequate reaction would be training, slow or fast activation. That would be normal reactions. Stress is an extreme, the body's response. It meaning that the body puts all its efforts in order to adapt. And it will adapt, but by high costs. So it will adapt, but at the same time it may damage itself in the process of adaptation. If stress lasts fairly short time, it's okay. The body recovers after that, and it still adapts. But if stress exists and persists in the body for a long time, damage becomes irreparable and permanent. And that's what creates diseases and disorders in our body, stress-related diseases and disorders. In this condition, we already have the diagnosis. It's a chronic stress. So chronic stress, it's not a normal physiological reaction. This is a disorder. Stress as such is a normal reaction. Now let's also distinguish stressful factor and stress. Now when our boss yells at us, this is not stress yet. This is a stressful factor. But how we respond to it, it can be stress. But it's our choice if we make it stress or not. See, it's always up to us how we respond to stressful factors. And especially if there are emotional or spiritual or mental stressful factors, some of us just make a choice not to respond it with stress. And for some people, one influence is damaging and stress creating. For other people, it's just nothing, just shake it off. It's totally up to us how we choose to respond. Don't blame the environment, right? It's you who identifies how you respond to this environment. Well, your spouse comes back all, upset from a hard day of work and starts throwing things around and yelling at you. Yeah, it can be stressful, absolutely. If you take it personally, if you take it upon yourself, it will be stress for you. On the other hand, you may choose, well, your problem, honey. Your problem, you deal with that. I'll just keep going with my day. I'm doing what I'm supposed to do. It doesn't become stress for you. So it's a choice. It's an attitude problem. There are many factors that you cannot avoid stress. And they really put a hard burden on the system. And this is not your choice. It's something that you really cannot avoid. Then you do experience stress, and it does put a burden on the system. And then we have to decide how we deal with that. Now, what happens in the system when we experience stress? All we know that we have incorporated in our genes fight or flight response, right? Our body, it's natural response of our body, fight or flight. When we experience a stressful factor, our ancestors, when this big tiger would attack, that's a stressful factor. So what normal response would be? Running, right? As fast as you can. So our bodies are built to give that kind of response. So when we experience stress, adrenaline rushes in our bloodstream. Massive release of adrenaline, which is, as we know, sympathetic nervous system mediator, right? So it invokes sympathetic nervous system mechanisms. Our blood vessels dilate, our heart start pumping blood, our breath is getting, we breathe heavily, we start sweating, lots of changes in the body are happening, normal physiological reaction to help us run and do some kind of heavy physiological activity to prepare our body for physical exercise. But in our conditions, we don't do that. We don't run from our tigers because our tigers are not physical tigers. They're emotional. They're mental. So instead of running from those tigers, we do what? We keep it inside. We're trying to digest it and trying to burn that adrenaline that is in our bloodstream. We're supposed to burn it by running, but we don't run. So it has to burn somehow, somewhere. And when it's burning, it is affecting our system, majorly affecting. And when it's again and again and again, day after day after day, what do you develop? You develop a conditions called sympathicotonias. Sympathicotonias. These are conditions which give you the dominance of sympathetic nervous system almost constantly. See, our body is built on dual regulation of functions, meaning it has to balance. Sympathetic nervous system, of course, needs to dominate part of our day, and sympathetic nervous system, fight or flight response, is something that helps us to do some activities. Physical activity, mental, emotional, doesn't matter. Sympathetic nervous system dominates in the daytime when we do need those activities, and we do need adrenaline to help us perform certain things. But then when we do enough damage to our system and we go to sleep, then parasympathetic system comes up, starts dominating, and repairs the damage that we did during the day under the sympathetic dominance. That's normal. We're sympathetically dominant in the daytime, we're parasympathetically dominant at night, and we repair the damage. Normally. But see, when you are under sympathetic dominance all the time, poor parasympathetic system is so suppressed, it does not do its job. It's suppressed and it cannot repair your system enough. You're sympathetically dominant even when you sleep. So you have insomnia. Because parasympathetic is not there. So it's not there to put you in a nice deep sleep. So instead of nice deep sleep, you are still under sympathetic dominance. Of course you have insomnia. Insomnia is one of the major consequences of chronic stress. So the body does not get enough rest. There is not enough repairing happening on your emotional, mental, or spiritual level, anywhere. If you have that, now your blood vessels, as you know, adrenaline constrict the blood vessels, small blood vessels. When your small blood vessels are constricted all the time, instead of being dilated under parasympathetic influence, what do you get? High blood pressure. Here we go. Second, the most common consequence of chronic stress. Blood pressure we need. We need high blood pressure at certain points when we really need to run away from tigers. But it comes and goes. It's supposed to elevate and then go back to normal. But it doesn't go back to normal. That's the whole point. Under chronic stress, because you get this injection of adrenaline all the time, you have the blood pressure elevated all the time. So that's the second most common consequence. After that, you get all you want. You get adrenals exhaustion, right? How many burned adrenals we have. You get disturbance in sugar levels, and you get behavioral problems, and depression sets in right away after that. That's the natural consequences of all this. So, and all that because we have sympathetic dominance over parasympathetic. Parasympathetic system is suppressed. Sympathetic system is way out there. Balance is distorted. There is no balance. So we need to counteract that, right? The little protocol that you guys have over there is created specifically for that. How do we use the fusion equipment in order to counteract sympathetic dominance, which you will have in approximately 90% of your clientele? If you ask them, most of them experience chronic stress. Maybe as a beginning of their disorder, but maybe as a result of their disorder. They were sick for so long, sickness itself can be a stressful factor, so they are under chronic stress already. So here we go with the little few things that we can do with our fusion equipment in order to balance the autonomic nervous system. This protocol, this particular one, is created for sympathetic dominance because it's the most common, but it also can be used for parasympathetic dominance if someone ever will find it. I never in my practice actually had that. I believe it should be. It exists out there. But how would you actually picture parasympathetically dominant person? I think it's someone like a sloth, you know, that little animal that yeah, sleepwalking, just being lazy and I think that's parasympathetic dominance, but that's but I never met anything like that. So so we will actually do this protocol for sympathetic dominance, but you know that you can pretty much modify it for parasympathetic dominance also. So there are certain reasons, the most common reasons for the imbalance, or we will call it ANS. When we say ANS, it's short for autonomic nervous system, okay? Okay, so ANS, right, stands for autonomic nervous system. Now we need to remember, we of course will be influencing different parts of autonomic nervous system depending on what we need to suppress and what we need to stimulate. So we need to know which is where. Sympathetic nervous system mostly can be approached through sympathetic nervous ganglia, which are all along our spine. Let's say that is a cervical spine. This is thoracic spine. This is lumbar spine. And this is sacrum area. So you can find sympathetic nervous ganglia all over the spine, like this. So if you influence the spine and paraspinal lines, paraspinal means approximately an inch to the side of the central line on the back, then you pretty much will be influencing the area closest to the sympathetic nervous ganglia. Now, sympathetic nervous ganglia mostly are in thoracic part of spine. They're all over the spine, but mostly concentrated in thoracic area. When you want to stimulate sympathetic system really strongly, then you do adrenals, right? So natural source of adrenaline. So you got adrenals. Now we can stimulate them or sedate them, but as we know, when we put our equipment, lasers or scanners on certain parts of the body, they will not stimulate, they will balance. So no matter if we have over-functioning structure or under-functioning structure, we will be putting the machines in the same very place. Obviously, with sympathetic dominance, what we need to do? We need to dump the sympathetic nervous system and bring up the parasympathetic, correct? In order to dump the sympathetic nervous system, we will be doing spine and around, especially thoracic spine and adrenals, of course, right? In order to stimulate parasympathetic, it's not that easy. Parasympathetic system is weak and is difficult to get. There are two major places where you can get really close to parasympathetic nervous system. Actually three, but we're speaking about two usually. So one of the closest where one of the major parasympathetic nerves, vagus nerve, comes to the surface of the skin, it's your neck, right over here. So let's say in the front, if it's your neck, right, so vagus nerve would be right over here. So you need to get your machines right on the neck. Then vagus nerve hides inside, and it's not that easy to approach. But the next part where it comes out, or close, it would be your area, how do you call it? Epigastrium, epigastrium, right? So it's your little bit higher than your stomach. Solar plexus, that's where it is. So solar plexus would be the second part. Let's call it SP. So that would be the second. And one of the easiest places to reach and very important for parasympathetic nervous system, believe it or not, is a tailbone. So over here. So your little tailbone. Because there is a pelvic nervous plexus that is coming out there. Pelvic nervous plexus is parasympathetic nervous plexus. So vagus and pelvic nervous plexus, if you influence them directly, you can stimulate parasympathetic. So just don't forget about that.
Do you mean the sacrum?
Sorry? Coccyx. Tailbone. Coccyx. So, okay, in my scheme, black is parasympathetic, red is sympathetic. So, Okay, so that's just for us to remember, right? So sympathetic, adrenals, and most of the spine, especially in thoracic area. Parasympathetic, vagus, solar plexus, tailbone. Very schematic, but remember guys, we are doing just basics. We are doing something for home care so people can memorize that, can remember that. So if you have insomnia, just insomnia, what are you going to do?
We're going to do laser.
Yep. Just we need to boost up parasympathetic, right? You boost parasympathetic right here, solar plexus and the tailbone. And if you are to choose just one, you don't have much time, you're overtired, and you need to put your laser or scanner, whatever you have, on one spot. That one spot would be tailbone. That would be my choice.
You do laser on the tailbone or the...
If you have two. If you have two machines, let's say you have scanner and the laser, then you can have laser, scanner, or the other way around, right? Or put laser, scanner, the other way around, and combine it in any way, shape, or form.
Laser on the solar plexus works great.
Well, Jane, yeah, laser on the solar plexus works great, makes you fall asleep right away, right? Yep. So that's to boost up parasympathetic. But if you are overstressed and you know you're overworked, you know you're overstressed, you know you will have problems falling asleep, stimulating parasympathetic is not enough. You need to dump sympathetic. Then you do what? Where do you put your machines? On the spine. Would be nice to iron your spine in the center, right up and down, on the left and on the right. We call it 3 pathways. Because it's kind of a pathway 1, pathway 2, pathway 3. In classic scanner technology, we do it as follows. We do the central line first, then we do the left paraspinal, and then we do right paraspinal. You just go up and down with a laser or a scanner. Now that's only stimulating spinal cord. But don't forget that we have also continuation of spinal cord on our face, and we call it 6 points on the face. And it's also a really good thing to put the scanner or laser for a little while on each of those points. And these are 6 points where trigeminal nerve leaves the cranium. So 1 pair of points right over here on the edge of your chin. It's like if you put a straight line from the angles of your mouth down to your chin, straight line like this. You will have 2 little spots right on the edge of the bone. They are a little sensitive, right over here, but little grooves. So these are the first pair of points. Okay, next pair of points, it's right over here. It's 1/2 inch away from your nostrils, like this, and 1/2 inch up, like this. So, or about a centimeter, like centimeter to the side, centimeter up. Also a little sensitive pair of points, try it. And the third pair of points, or first nerve of trigeminal, pair of trigeminal nerve, first pair of trigeminal nerve, nervus ophthalmicus would be right over here, edge of your orbit, about 1/3 of your eyebrow, underneath. Just touch the edge of your orbit, you will have a little groove there. So that's the first pair of points on the edge of the orbit, like this. So 1 pair, 2, 3. Very good to put your scanner even for 30 seconds on each of those points. Usually it goes like this. First, on your right, if you're working on yourself. 1, 2, 3, 4, 5, 6. That's the order. And we usually finish with 1 point, which is one of my favorites, especially for insomnia or any kind of sympathetic atonias, third eye. Your scanner or your laser, right on the third eye, right over here. So that's kind of the simplest possible recommendations. Now, the protocol itself, ANS balancing protocol, is a little more complicated because you need to take into consideration very common conditions that we often create sympathetic atonias or sympathetic dominance without us even being aware of it. And these two conditions are hyperventilation, overbreathing, and dental distress syndrome. We don't even often think about it, but it can be a major source of your stress.
For the 6 points on the face, how would you determine whether you're going to use the laser or the scanner?
For 6 points on the face, we prefer to use scanner if you have it. So because these are points. Scanner is easier to use on the points than a laser unless you have the enhancer. Enhancer would be also great to shine, but we really like, if there is a choice between scanner and the laser, we prefer to use a scanner for 6 points on the face.
CEDA or DOV?
Perfect. Depending on the condition, either. CEDA or DOV will do. On small points, small areas, we usually typically use scanner or laser with enhancers. So, Dr. David, do you want to take over for dental distress and hyperventilation?
You've heard of DDS, right? Dental distress syndrome, which is also created by dental degree specialists called dentists. So, in the laser user manual, one of the things that they talk about, the first thing to do with the soft laser to assist is just to take the soft laser. You can do this with the Dove or actually any of the equipment except for the Solaris blanket. So in the laser user manual, there is also what we call 6 points. And the first one is actually you can either do it yourself and look in the mirror in which side of the mouth or the cheekies are more puffed up. So on hers, which cheeky is a little bigger? So it's this right side? Yeah, that's what I was getting to. So it's just as simple as mode 1, just putting it right on the TMJ area. Okay, and basically the ideal is to do about what they call 6 breaths. Well, what's 6 breaths? Because every person is breathing at a different rate, anywhere from 30 seconds to 60 seconds. I like to do it where they finally get this nice deep breath. They go, and for her, it will take a little bit. And what that will do will actually relax the muscle here. And when that happens, the TMJ, did it just happen? Did she? She just did it. So the next point is underneath, and that's the pterygoid right here. So if I were to really go up there, how does that feel, by the way? Did you see the owie? Okay, like, yay, 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 yay. Okay, so the pterygoid is this muscle that goes all the way down. But the thing is when that baby is tight, it really affects big chunks of the body. So what we can do is now take the soft laser or the Dove or the Cosmotic device and put it right underneath. And we're going to go at least 60 seconds, 30 to 60 seconds, or Dr. Lytle likes to say 6 breaths. Okay, and what am I looking for? Because I'm a breathing kind of guy. I'm going to look for that breath, that a little bit of the sigh.
And what's that spot called again?
Pterygoid. And if you have dental distress, literally that will be really sensitive. Enough where I was pushing on it and she's like moving up with me. Okay, I'm actually feeling the muscle relax. So, how does it feel to you?
Great.
Yeah, so she's feeling, as my daughter would say, betterer.
What mode do you have that on?
Just mode 1. So, there we go. Do you see she's already relaxing a little bit? Okay. So now if I want to check that, I'm going and she's not lifting up on me. Right? I mean, I'm pushing. It doesn't feel the same, does it? No. So literally that reduced the dental distress right away. Now if we had a heart rate variability device, or we had a way to measure blood pressure, we would see those two things regulate right there. The third spot would be the alarm place right here of the lungs. Am I correct? What's this baby right here? You're the acupuncturist. It's just like the alarm point.
Yeah, or just it's like lung 1 and lung 2.
Yeah. So to another way to look at it, it's like the major junction box there for the lung meridian, which definitely helps the breathing quite a bit. And one thing you can do, which is great, is you can always just poke them first and see how they feel. And actually, how does that feel?
Good.
Not bad? Okay, we've done it enough. Earlier, if I did that, she would have gave me the owie. Owie. So, and it will take a little longer. Why? She's wearing black. Okay. But what's so interesting about this soft laser with the soliton wave is it goes through clothes great, so we don't have to unclothe them in order to get a wonderful effect. So the dove definitely needs to be put directly on the skin. There, she just gave me that. You see the bosom heave a little bit? So.
You get the same result with the 715?
Absolutely. Sure. It's going to take possibly a little bit longer, but the effects will be more profound because you're working on a lot of other things than just that one. But yeah, these points are really good. So now, just stand up a little bit. Now, what we didn't do was actually look at the shoulders. Usually just by doing that, the shoulders many times will start evening out a little bit. We would kind of notice it. But how does she look? A little more relaxed? Yeah? She looks better? How do you feel?
Sleepy.
Okay. Now, have you been going for a long time? Mm-hmm. I mean, like...
Yeah.
So is finally the fist relaxing?
Yeah.
Okay. So now the next place that we want to go would be right in this... Right in the groin. Yeah, thanks. Right in the crotch. To the right.
And you do right and right?
If we were to measure legs... You know, many chiropractic and massage therapists will actually put someone on the table to measure leg length. This would, simple procedure might immediately relax the muscles in that area, and guess what happens? Those leg lengths will many times even right out. So, we try and do the puffiness. The reason is that when you have more of a chipmunk, that means that side has got some more stuff going on. And then we would just end up right here, right on the... Boy, she's right there with me. Just right in that area here. So. No, it's still working. It's on. Is it blue up there?
No, it's okay.
Yeah. One of our... wonderful associates, Dr. Herb Yolen, did a wonderful study showing just on the points that a dentist could actually affect heart rate variability and blood pressure within 3 minutes, 2 minutes, just by doing these 4 points. That, you know, TMJ, pterygoid, and actually 3 points, the lungs. And it evens things out quite a bit. We do have that study available. We just didn't put it in your kit.
So is that on the coccyx then?
No, I'm just doing it just above, just right there. It's actually in the sciatic type area, right in there. So, I mean, if she had sciatic pain, and she does, so we can do that. So, also in the laser user manual, there is these points very clearly marked, and how you can test them with, you know, by pushing to get the effect. But how are you feeling now?
Good.
So tell me about the relaxedness, because it's changed a little bit.
Yes. I feel much more calm.
Yeah. So that's not bad. Within 5 minutes, not even 2 cycles, she's feeling here and now. What else?
I feel really like more even.
Yeah.
Yeah, I feel more even. But really, really good in my jaw.
Yeah, you're a clencher.
Yeah.
Yeah, yeah. And also you're wearing something.
Yeah, they made me wear.
Yeah, that's wonderful. She's lost a lot of vertical height in her back teeth, so her front teeth have lost a lot of So that they made her a beautiful plate, which is great to help with the dental distress disorder.
In the book, it talks about the
Bite tabs.
obstacles.
But doesn't she look more beautiful? No, seriously. I mean, it's just amazing how in less than 5 minutes you can help somebody. So what a great protocol to assist someone right away. So you grew 2 inches back there, she.
And this is also
Thank you.
called
Yeah.
ANS balancing protocol, but it also can be used just on itself as, well, when you have someone with dental distress, just don't forget that this thing exists, and this is a very common thing. We just don't think of it, but dental distress is a very common, unfortunately.
It's been stated that over 70, maybe 75% of everyone has some type of a dental distress, which is seriously affecting their autonomic nervous system. There are so many factors in there, I can't just say one thing. But what it is as
tooth coming in crooked and going into another tooth.
that will affect, but there's so many of us don't have the maxilla area that we had in the past. So what it is, that's where the crowding is.
Can any of this help that?
It definitely will affect the symptoms of it, but when that deals with structural things, then we have to really deal with a really good neurologist who is called a dentist. Okay, dentistry really is neurology of the highest order, but they're not taking responsibility of all the neurology that actually has occurred. So, I mean, you can shave just 1 millimeter off of one tooth, and you will affect C1 immediately. You can create scoliosis in moments, you know, and you can also cure it in moments too, just by this alignment. One of the wonderful areas is called chirodentistry. It's to work with that, and you guys are going to be able to work. The thing that I have to say, what's changed me from just being all laser is meeting this woman and then really seeing the power of how the scalar affects the structures or the function before the structures. Remember in that osteomyelitis, okay, that person got their function back and then their structure. One of the things that we see with the scalar and the cosmetic is literally we're seeing the dental distress function, the dental aspect come back before the structure comes back. So it's great. So, I mean, and I don't know if you realize what I'm saying. It can be really profound because a lot of us have dental stuff. So this side is higher, okay? So to check for the dental stuff would be just kind of go in here. How's that?
Fine.
Fine. Now, that's not a ouchie?
Not too bad.
Okay. Do you hear it? Not too bad. All right.
Fine.
That's not an ouchie.
That's sorer.
That's sorer? Okay. So there, and now I'm going to go here. That's really sore. Now what about that one? Okay, so they're both sore. So that tells me just that quick test, you know, you're just going, you know, what's going on here? Well, not so bad. Here, I know she's going to go up if I really, you know, but she's really feeling it more on that side. And the alarm points, that all says dental distress. And it also tells me that there's some breathing stuff going on. So, yeah, right there. It's a yucky. Okay. So, what do? Soft laser. We could use the Dove. I'm going to go on the poofy side. So we're going to just hold that there. By the way, you do one side, it helps the other. So if you do both sides, that's great. But just know when you do one side, it will help the other. Laser light cascades. It doesn't stay in one place. Remember those tubules of light, you know, were fiber optics. Some of the first studies in low-level laser were done with incisions on large animals like bulls or stock or steers, where they were then using laser on one side and not using laser on the other, and they were trying to see, well, would the laser help? And one of the problems they had with laser light is no matter where they put it on the body, it helped all the incisions on the body. So where if they put an antiseptic on one side, you know, it healed differently than the other side. But with laser, both sides of the rump got better. Does that make any sense? So why? Because that light cascades. So she's a toughie. She's going to need a little more light. I'm a toucher, so I'm always touching like the back and the neck. And one of the beautiful things about using the soft laser, especially if you put your hand on the back, is all of a sudden those muscles relax. You know, you can just feel it. It's this like, it's like, oh, I can move her around. She's not like the steel rods, the piano wires that was up here. Those wires just started relaxing. Good. So there's that. And so now, even though I did that side, how's that? Is that better? Mm-hmm. Okay. A lot better or a little bit better?
A little.
Okay. Well, a little bit is good for you.
I didn't feel it at all.
Okay, so nothing. So that's good. Mm-hmm. Nothing like before. And just see if it's cascaded. How's that?
Better.
Okay. So just that has helped, but I'm going to go a little bit further. This side was more sore than that, so I'm just going to go to that side. But I can just feel those little wires in her neck just relax. So it's kind of fun. What's really interesting, anybody here get professionally massaged? Okay. Do you want to have like the equivalent of 2 or 3 hours of massage in 1 hour? Bring your laser with you.
I do every week.
Isn't it great? And you see the difference. You feel the difference right away. You know, you put that laser on you. And
My back just popped.
Really?
Did you feel that?
I felt something.
Yeah, it was right straight through.
So a pop meaning it.
Excuse me, I'm sorry.
Yeah.
That laser has literally saved my hands 25 minutes out of the massage.
Wow.
I'm a massage therapist. And when I put that laser on my client, it saves these knuckles 25 minutes.
And what's nice is you embrace the patient or the client versus the patient or the client bracing against you. It doesn't matter. Just stick it on there. So it doesn't matter. Literally, I mean, I wish I could say, well, you put it in this spot. It doesn't matter. Just stick it anywhere. I kind of like working, yeah, or anywhere, the chest. I'll put it on the feet. It doesn't matter. I just got to get the light on them. And instantaneously, someone who knows how to palpate will feel the difference. So now I go like here, and she's like really cool. But now I'm going to need your, we're going to do the control pause again. We're going to need your second hand. So you ready? Mm-hmm. And hang on, stand up. So I didn't do the whole 6 places. Do we got a little bit of a change?
Yes.
Tell me about the change. So the shoulders are a little better. Okay. All right. What else is going on? Clearer. Quality of eyes. Notice a little difference there. Yeah, softer, not as hard. Right?
She's not clenching her fists.
Ah, right. And boy, if you can feel this neck and shoulders, it was like I worked with her about 10 minutes. Mm-hmm. You know, and she's not bracing against me anymore. She's just relaxed, like, hey, I'm here. I'm right here. And actually, what's fun is I can push her now, and she's stable. Right? Where before you could almost tell she was like, you know, couldn't you tell it? You know, like, I'm going to stand up here. But you're not. You're strong. No, I'm exaggerating it. Okay. But yeah, the softness here. Isn't that? So again, that's fun. So you ready? So yeah. Now we're going to exhale again. And we're going to see how long that pause goes. So let us know. Right there. Wow, that's huge. 10 seconds longer, and with ease. All right. What that means, if we did, and I done all this breathing chemistry stuff, it just said her breathing chemistry evened out in less than 5 minutes. How do you feel?
Great. Thank you very much.
Look at the smile. You see the sparkle in the eye? Okay, so these points are powerful because you're affecting systemically the whole body. So, how do you feel?
Oh, wonderful.
So it feels good.
Thank you.
Yeah. And what I like for you is I push you and you're strong. You're rooted. So.
We all done?
Yeah, for now.
Thank you.
So we learned something new, the control pause. We'll get you more information on that to really explain it. But that thing is really powerful. Okay, because anyone can do it. You can do it at any moment. So, please.
With this also help with the opposite situation where the people have trouble breathing?
Yeah, absolutely.
I'm thinking specifically, I can't remember the name of it, but the thing at night where people...
Oh, sleep apnea. Yeah. Sleep apnea is definitely a nervous system disorder, and it also is caused many times by breathing with your mouth open. Okay, because when you breathe with your mouth open, you're over-breathing. See, when you over-breathe, it means that your carbon dioxide level gets too low. You're actually exhaling the actual gas that your body needs in order to attract oxygen into the cell. So it needs to be regulated. It doesn't need to be too high, but literally to get someone to be too much carbon dioxide is almost impossible. Okay, the problem is we have too low carbon dioxide. So it's kind of, did you ever hear of water everywhere and there's none to drink? Okay, it's oxygen. You can have an oximeter reading of 98%, but nothing's getting into the cells. So, and that's why they put someone on a CPAP machine. A CPAP means, they're the Darth Vader. Right? Now, the thing about that is it's controlling their exhale, actually. So it's making sure their exhale is longer than their inhale. And when you do that, what happens? The carbon dioxide level gets normal, and then they don't have sleep apnea. So sleep apnea is a way for the body to actually stop the breathing in order for the carbon dioxide levels to go up, to be normalized. Now you want the simple way to deal with that? Okay, and it's a special tape that's made by DuPont called micropore that you can put on their mouth, which forces them to exhale through their mouth very slowly. Not duct tape, because that will create the opposite problem. They'll go into hyperventilation, and then they'll be more anxious, and life's bleh. But it's micropore. So, honey, tape their mouth shut. And the problem is a reflex. In the American Indian culture, it was very normal for the mama to always close the mouth so the baby always breathed through the nose. And those babies never have problems. But when you have a child that's a mouth breather, it's almost one of the worst things health-wise we can do is to have that exhale of carbon dioxide too much. So, all right, we can talk more about that, but that was it. Okay. Any questions about that?
We'll just continue with the protocol.
Okay, great. But really powerful, simple.
Okay, guys. So we got through a little bit part of dental distress and a little bit of overbreathing. So you kind of know what overbreathing means, right? And that overbreathing creates the sympathetic dominance, and dental distress can create sympathetic dominance. So going consecutively through our little protocol, when we want to deal with sympathetic atonias and ANS imbalance, first thing you think, okay, is this person overbreathing or not? You may diagnose it, may not. But just in case if this person is an overbreather, the simplest thing you do, you take your laser, you put it in the mode 2, put it right in the chest area, right over here, right? You take your scanner, if you have it, turn it on, and put it on T3, T4. Well, it's a first thoracic vertebrae. Okay? So, no, it's actually T2, T3. T2, T3.
So it's right below the hump?
Basically, yeah, right below the hump. T2, T3. So laser goes for 3 minutes on your chest, and your scanner, if it's a cosmetic or scanner, it doesn't really matter. You have a 715, 735, CDAV, DAV, whatever you have, just turn it on and put it right below the hump on your spine. That will help to stabilize your breathing because T2 vertebra is your lung vertebra, and here you're right on your breathing center. Now, if you definitely have an overbreather, but you cannot stabilize the breathing, cannot lower the breathing rate down with this particular situation, then take your Dove or scanner and put it shortly right on your upper lip, right over here. Turn it on, of course, and briefly put it on your upper lip. It's better to do when scanner is fairly strong, has fairly strong energy, so the person will like, kind of jerk, but after that, the breathing rhythm will reset itself. So put it right here. You don't have to put the full electrode. Remember that with the scanner, your impulses run between electrodes. So in this little empty space between two electrodes, that's where electricity happens. So it's enough if this part touches the upper lip. You don't have to have the full electrode on the skin. Just as long as two of the electrodes touch the skin. So that's how you reset the breathing, okay? And then you put again your laser on the chest, your scanner on T2, T3. Now, if you have only a scanner, you can do T2, T3, and then kind of massage the chest with a scanner, if you have only a scanner. If you have only a laser, here, and you, of course, put it on the back, right? But it's better just to, for economy of time, you do both. That's how to help overbreathing quickly. Now, the next would be check client for DDS, right? Dental distress. And if you suspect that your client does have DDS, so you would put on a TMJ, right? You put and you again, you can put your scanner, any of the scanners that you have, on one TMJ, laser on the other one. Then switch it around. Then do it on pterygoid, this way, and switch it around, right? And then you would do clavicles, just as Dr. David showed you, scanner on the laser. And that's the other way around. And you can even continue over here if you want to. So that's to quickly balance the consequences of dental distress. If you suspect that it's something that your client may have. Now, next part of the protocol will be dealing with neck and shoulders, because that's where our stress sits. That's what our chronic stress does to us. It puts a lot of pressure on our neck and shoulders. It tightens them, it hardens them, and as a result, we develop certain abnormalities of our spine, because when spinal discs are constricted by stiff muscles all the time, they lose liquid, they lose water, and they degenerate. So what you want to do, you want to relax your neck muscles as much as possible. In order to do that, if you don't have a scanner, then of course you will lose your laser. You will use your laser in mode 1. Just press it once, and just do that for your neck and shoulders, and keep it in a part of the neck that is the most stiff. You'll just do that to your neck and shoulders. But of course, if you have a scanner, it's the best, because scanner relaxes the muscle, neck and shoulder muscles the best.
Dr. Irene, I
Yes.
have a question. We're talking about the stress factors and up in the neck area, the TMJ. How much of that do you believe is attributed to migraine headaches?
I believe that any fairly stiff muscles in the neck will always give you migraine headache.
And pelvic floor.
Yes. And pelvic floor, which we will do on Monday. Pelvic floor release, by the way, it's a technique for Monday.
So if you have a migraine, if a person has a migraine,
that's the first thing. That's the first thing you do.
probability of migraine.
Yep, migraine would. I would check definitely C1, right? The first cervical vertebra, because misalignment of C1 is a very common condition. Dr. Dennis, you probably would agree with me. That's one of the most common conditions which goes undiagnosed and is really difficult to skillfully align. But that contributes to what we call ball and ball syndrome, when your entire spine goes, right, just follows and kind of goes, develops curvatures. Tone of muscles will be different. And here we go with your headaches right there. So it's one of the major reasons for headaches, which goes undiagnosed also. And when dental distress and C1 misalignment very often go together. Right? Okay, so what I would ask you to do is just turn around, because we will be working on the neck and shoulders, okay? And we will need, and we will need some skin. So, yeah, we will need some skin. So what we're going to do, we're going to...
You can realign C1?
Oh, yeah, of course you can. Of course you can. I will be using both scanner and the laser, just because I have it. And because it speeds up the process. So let's assess the situation. So any stiff sensation of stiff muscles in the neck?
Well, yesterday on the plane, because I was on the plane for 12 hours in the middle of the seat.
Yeah, 12 hours on the plane does that to you, right? Okay, so let's check for our motions. Okay, of course we will assess the tone of muscles, definitely, that's what you would do, right? And just to change the energy flow a little bit. But we'll also ask to turn your head to the right as far as you can, which is pretty good, right? That's a good range of motion. And to the left. Good. Any stiffness, any pain?
Well, you can hear it goes clunk.
Okay, and slowly to the back, like all the way back. That's pretty good range. And all the way forward. Well, forward we have a little restriction. It doesn't quite go.
Yeah, it doesn't feel smooth.
Yeah, it doesn't feel smooth. That doesn't quite go. So definitely we have certain stiffness in our neck and certain misalignments there. So what we're going to do, we're going to work what we call the Christmas tree technique with the scanner. Christmas tree means Christmas tree has a trunk and it has branches. So we will imagine that our central line, our spine, is a trunk of a Christmas tree, and our muscles around are branches. So what we're going to do, we're going to take our scanner and move it up and down, just up to the approximately wing bones area, and go up and down, watching if we will have any particular sticky areas somewhere on the way. If we do, we treat them more. These areas, sticky areas, are called areas of small asymmetries. And we will be talking about it later on, but we always treat them with the scanner. And they also can resemble some kind of a resistance on the skin, or maybe some sensitive areas. You let me know if there is some areas that are more sensitive than others. They can create different sound or create different color on the skin. So anything that is a little bit different on the skin from the rest. It's a little resistance right over here, just around the C7, probably more sensitive, right? A little bit over here. So if we have something like that, we will be working on it a little more, because to equalize everything. So we will just working a little more on this area. Now that's the trunk. Now we'll start doing the branches, and branches we'll be doing this way, right? Just like that. To the right and to the left. And also looking for those areas which are little sticky, create little resistance, and that can be anywhere. Now, I just showed you what I'm doing with the scanner. Now I'm including the laser in the treatment, and with laser I can just shine on those areas which create resistance, and in this situation this area presents a resistance. I just shine on it to remove the resistance until it's smooth. I will have a little resistance over here, but it's gone now. And let's see what's on the right. So I can just do what I'm doing and shine the laser light. I'm not detecting anything on the right hand side. Or what I also can do, I can do this. Okay. So it's up to you how you want to work it. So you create your Christmas tree.
What level of intensity are you using?
I'm not actually, it's just the default. I just turned the machine on, that's all.
Mode 1 on the laser?
Yep, mode 1 on the laser. Okay, so you're doing it approximately when all your areas of resistance are gone, and which is just about now.
Not seeing any red. I'm not seeing any.
I'm not seeing any red spots. It wasn't much. There is still a little resistance above C7 and a little bit over here.
And you'll be doing it the same way with the 715?
Yep.
You might go a little bit slower with the 7.
With the 715, yes, you. But a little bit over here. So whenever you feel, and areas of resistance will migrate. They will be in one area one moment and in the other area in a different moment.
Call it chasing the pain.
Chasing the pain. There is no resistance on the right hand side. Can you feel it, the difference, right and left?
Oh yeah, definitely. Yeah, left hand side.
Left is much more sensitive and creates more resistance.
He's really not a great.
Okay, but let's compare now. Let's try again your right and left. Try your motions to the right, to the left, and tell us what you feel.
Yeah, it doesn't feel crunchy.
Doesn't feel crunchy. And you can go more forward, right? Yeah.
It feels a lot smoother.
A lot smoother. Okay, we are not done yet. There is now comes the fun part. So that usually continues with you're working with the neck and shoulders for about 10 minutes. I just don't want to go all the way, but until basically everything is smooth and everything moves all the way, you know. One technique that I really want you to guys experience and see, we call it the little wings, and it's a really fast way of creating relaxing the shoulder muscles. Little wings we utilize in any situation when we have chronic stress, when we have misalignment of SC1 misalignment, any kind of tough muscles stiff muscles in the neck and shoulders, and even in the low back. The premise of this technique is when you have stiff muscles and you have difficulties relaxing them, if you constrict them, they will relax much faster. So you are creating extra stress on the body, so the body can do more about relaxing things. So we will be artificially creating muscle contractions of the shoulder muscles, and after that shoulder muscles relax much faster. For that we use the Dove mostly, or the scanners of first generation, because they have certain mode that gives us 3 seconds of active time and then 1 second of pause when machine doesn't emit any impulses. So it's 3 seconds active, 1 second non-active, and that pulsating mode creates better muscle contractions than other device. You can do it with other devices too, but then you would have to put the device on the body like 715 and then detach it, create contraction and then detach it. We really don't want to do that, so if we if we have a choice, so we prefer to work in with the Dove in mode 3. Mode 3 means you will see 3 seconds light is blinking, and then 1 second pause. 3 seconds. 3 seconds stays on, 1 second off, and that's how the activity will be going. Now we usually set the energy level on ourselves, so we don't shock a client. So it has to be fairly strong, but not too much. I usually check it right on this area, obviously, like behind the ear, on myself. So I'm sure that it's okay. And what we ask a client usually is just relax your muscles, and when then your shoulders will start jumping, just let it go, okay? Just let it go. Now, what is important is the place where you put your machine. So what I would ask you, if you can just turn your the chair like a little bit to the right so guys can see. Yeah, can you see, guys? Right here. Usually the place would be right where your neck starts or ends. Kind of the muscle should sit between two large spheres. Yep, head straight. And it will be unusual sensation. So, yeah, here we go.
Yeah.
Here we go.
Now I know what James Bond feels like when he's being tortured.
Well, come on. I tried it on myself. It's not that bad.
No, I'm joking. Yeah, it feels like someone's grabbing hold of your muscle.
Yeah, and let the shoulder go, because right now we only have head going. And what I want the shoulder up. I want your shoulder up, and yeah.
So you move it.
Yeah. Well, now we're getting the shoulder. See, can you see that, guys? That's what I want. I want the shoulder up, and let it go. Drop it. Drop the shoulder when it goes away. Drop it. Drop it. Drop it. Here we go. Now it accumulates. Now the information flows. It doesn't happen right away. Yeah, and drop it when it goes away. Drop it. Yep. Here. Good. And drop it.
How long do you do that?
And let it go and drop it. But can you see how shoulder goes now? That's why it's called the little wings. Drop it. Good. Good. And drop it. Okay. About 5-6 times on each side and the other side. And shoulder usually doesn't jump right away. It takes time because of the contracted muscles. Contracted muscles do not respond right away. It takes the left side will take longer. Here we go. We started responding. Okay.
Yeah, I feel my head first.
Yep. Yep. Good.
I did it on myself, Dr.
Yeah, you can do it on yourself.
But I only did it one time, and I jammed up those. Where was the middle? By the time I went to see Joe, I was like a mess. So, like, you certainly need to be doing it more than once.
Oh yes.
Yeah.
Oh, absolutely. Okay, so we are not getting good shoulder motions on the left side, which tells us that left side definitely blocked and needs more. We get some of it, but not good enough.
But it's not.
Yep, that's what I'm going to do.
Increasing it, yeah.
Sure. Yeah, well, we get a little bit, and drop the shoulder if you.
Relax.
Yeah, just relax.
Wait till you get that shoulder to raise.
Not necessarily. Sometimes I can see the muscle twitching right over here, but the whole shoulder doesn't want to go yet.
You can turn it up.
Yeah, sure, you can turn it up. Well, it's usually we do it. Well, it goes a little bit. We usually do it about 5 to 7 times, and if it doesn't go, just leave it until the next time.
It's beginning, isn't it?
Yeah, it's beginning. Yeah, it's beginning. Okay. Now enough for the little wings, because now we want. What we want to do, we want to create, we want to clean up, right, your actions. So you want to do that.
Do you think they'd raise faster if you lasered them first?
What?
Do you think that they would raise faster if you lasered them first, too?
Yeah, because I did laser them first. And we get really good response on the right, but the left side still requires attention. So that would be our step number 3 in our ANS balancing protocol, correct? You don't have to do little wings all the time. We're just showing you your options. So the full-blown ANS balancing protocol would include DDS balancing and breathing balancing and little wings and working on neck and shoulders. So you don't have to do little wings, but neck and shoulders need to be worked at. That's for damn sure. Okay, try it now.
So now his neck would be balanced, centered on the spine.
Yeah, no, that's good.
Feels good?
Yeah.
Thank you.
So you would expect that to align the C vertebra C1?
After a while, not from a single procedure, but usually.
Okay, so with the 715 and the 735, you would have to put it down for 3 seconds, lift it up for a second.
Correct.
And just keep doing that.
Yeah.
So let's see how you look straight on. Shoulders.
Interesting.
We still see the left shoulder up high.
Still up?
Yeah.
Yeah, left shoulder is still, we didn't get quite good contraction.
You didn't do the
We'll
dental
see how it
thing.
goes tomorrow.
Mm-hmm.
But how do you feel?
No, feels good. No, that's
Real relaxed?
Free?
Look at
Feels
him.
free? In the shoulders?
Cut off my head.
That's what little wings do. They actually make you feel free. That's why we're almost ready to fly.
It's addictive.
Oh, it is. And little wings you can easily do on yourself. It's not a big deal. You just relax one side, put the, your balls on the on your muscles, and you sit in front. Right? Okay. So next, what you do for ENS balancing would be your adrenals are overstressed, correct? So you take your laser, you take your scanner, you put it on your adrenals, one way, and then the other way. Laser would be mode 1 or 3 or 5. And the scanner, just turn it on. So you want to do it maybe for a couple minutes each side. Then you want to work a little bit, if you can reach it for yourself, on thoracic and lumbar spine, because you want to address those little sympathetic nervous ganglia. So what you want to do, you want to work on thoracic spine, right and left. So you want to do your 3 pathways, right? On the right and the left, that would be the best. With your laser and your scanner, again. You can do the laser on one side, the scanner on the other side, alternate, or do this, it doesn't really matter. Whichever way you want. We prefer to move our machines from top to the bottom if the client have tendency to high blood pressure, and if they have tendency to low blood pressure, the other way, right? Doing this. Now we guys dealt with calming down the sympathetic nervous system. All that we did is to calm down the sympathetic. And now we need to stimulate parasympathetic, but we already know how to do it, right? So we will take our laser and our scanner, and we would do the biggest nerve, right? Right over here. So we can keep your doves or scanner just behind the ears, right over here, and laser on the other side, like this. Or if you have only one machine, then on one side first, then on the other side, then switch it around, and you start doing this to your neck. Right? That would be the first. Then where you would go? Next place. Solar plexus. You will go with your scanner or your laser. If you have both, put your laser on the solar plexus. Put your scanner on the tailbone, correct? And then switch. So your tailbone is almost the last part of your procedure, but we like, if you have a scanner, do it as follows. Do the tailbone first, then put your, with the scanner, then put the laser on the tailbone, and start doing your 6 points on the face with the laser. 1, 2, for about 30 seconds each. 3, 5, 4, 5, 6, and this one. So you end up with your dove on your third eye, with your laser on your tailbone. And then you switch. You put your laser in mode 2 on your third eye and your scanner on your tailbone until it doses. Continuing with our conditions. So we were talking about chronic stress and how we deal with chronic stress. Now let's concentrate a little bit more on consequences of a chronic stress, which would be headaches, right? And low energy levels. So headaches. Guys, someone who suffers from headaches? So, as you guys know, headaches have many different reasons, right? It's just a symptom. It's not as a disease as such. And most common reason for headaches is the chronic stress, of course, and blood pressure, right? High blood pressure gives you headaches all the time. Now, migraine headaches are special. They are not high blood pressure related.
I have very low blood pressure.
Right. So they are not high blood pressure related, but they are still very debilitating headaches. They actually have a reason of constricted blood vessels in the brain, and the result of it, poor blood circulation in the part of the brain. Migraine headaches mostly only have half of your head, like a splitty headache in half of your head, and it also has some other symptoms like dizziness. Person can get nauseated, and light sensitivity, sensitivity to sounds, and migraine headaches really last a long time, come from nowhere, all of a sudden stop. Is that the case?
Yes.
So what does help with your headaches typically, if anything?
If I get on top of it with something called Relpax, that helps. If I wake up with one, not much of anything until I knock myself out with something. Like a nasal spray or a major pain medication, which I would prefer not to have to do, but when you wake up with them, they're already full blown, and it's difficult to ever get them back in control until they're gone.
Right. So guys, let's create a certain, what we can do for migraine headaches, and not necessarily our equipment, but what if anyone knows any magic technique or something that can help with migraine headache. John?
My husband had horrible migraines. Put him in the hospital. I would see him on his knees crying. And we were going to someone who is a holistic person, and they recommended coffee enemas. And he did that we probably did it for several months, and he never had another. That's 23 years ago. He's never had another migraine.
Coffee enemas, right? Coffee enemas are really good. Any opinions why?
Caffeine absorption.
Well, I think the bowel is, if it's not working properly, I think that can cause the headaches if you're not eliminating, if you're not.
Definitely sluggish digestion can contribute to that. Elimination of toxins from a liver, if it's not going properly, it will contribute to headaches. Absolutely. It's basically toxicity, so coffee enemas help to eliminate the toxicity out of the body. Plus, coffee creates effect on the small blood vessels, so it kind of massages small blood vessels.
We did it while he was during his headaches, and they would subside almost immediately.
I do 2 chronics that they come regularly for massage every week. And what I usually do is I put them in a still point position that you do with craniosacrum, and make sure that now that I have these, definitely I do. But before I didn't know about them, it was a lot of work because I made sure I really released the neck, released the neck and the shoulders. And I've had good luck with that.
That's the most important. Release the tension in the neck and shoulders in any way possible. And how we can do that without our equipment? It's to massage, right? Especially if we are in a healing partnership with someone, with our loved ones. We can massage neck and shoulders. You can... yeah, we don't need that for now yet.
So we don't need it?
But we will actually pretty soon. So I would leave it now.
Irina,
awesome.
Just to bring this up, mine are hormonal. So
yeah, we'll get to that too.
Yeah, there's other kinds of.
Circulatory reason can be one major reason for headaches. Toxicity in the body can be another major reason for headaches. And one of the biggest for women is the hormonal imbalance. Absolutely, right? If you have estrogen progesterone imbalance in the body, that will most definitely create headaches or migraine headaches. So keeping in mind those 3 major reasons, when you have a headache of unknown nature, you would like to cover all the major reasons, thinking that you will hit one of them. So if we are thinking about blood circulation and hormonal imbalance, where we need to work, it's neck and shoulders. No question why we need to work on neck and shoulders for blood circulation, right? So improvement of blood circulation in our vertebral arteries and improve blood flow into the head. So we would work on the neck and shoulders just as we did with our laser and our scanner, or if we don't have our laser or scanner, then just massage neck and shoulders, just trying to release the pressure, do a little shiatsu technique, as DJ does so skillfully. Do whatever you can in order to relax those tough, stiff muscles in the neck and shoulders, and make sure that tough, stiff muscles in the upper neck and on the base of the skull are released. If you have a laser or scanner, then of course you will be doing what we already know. So you will be massaging your neck and shoulders with the laser or scanner separately or in combination. And one of the main things to do is to put your laser and your scanner, either or both, if you have both, on the base of the skull. Right on the base of the skull. For the laser, that would be mode 1 or 2 for one cycle. For scanner, until it doses, right on the base of your skull. That will help relax muscles that usually are around C1, especially if you have C1 misalignment. And C1 misalignment is a major reason for headaches and migraine headaches. So if this is the case, and if this releases and your headache, next thing you do, find a good chiropractor and make sure your C1 is in the right position. Okay? Make sure your C1 is where it's supposed to be. Because if what we just described helps, it means that somewhere there you have a misalignment and you need to put your C1 into place to get rid of headaches. Am I correct, Dr. Dennis? So you can release the pressure, you can help your headaches, but until you really put C1 in place, it will be still on temporarily relief. In order to get rid of your headaches completely, that's what you need to do. You need a skillful chiropractic procedures. Unless you do your scanner and laser on a regular basis and the body aligns it on itself, which it can do actually. So that's one of the reasons. But why we would work on the neck and shoulders also, if a reason for our headaches is hormonal and you have estrogen progesterone imbalance or PMS symptoms or something like that. Why would we work on neck and shoulders? What's the connection? Any ideas? Well, connection is really interesting. Our body is a symmetrical structure. We have right and left symmetry, which means we have horizontal symmetry. Well, if you divide the body by middle line, we are symmetrical right and left. Correct? Mm-hmm. If you divide the body on the level of your diaphragm, we are symmetrical top and bottom. If you divide your body that way, we are symmetrical front and back. We have these corresponding points for each organ, which are called reciprocal points. Your right hand will correspond to your left hand. It will be symmetrical points. But also your right hand would be reciprocal with your left foot. Right? It's a cross. And for example, your C7, most prominent cervical vertebra will correspond to your thymus. They are both immune points. If you consider several symmetries, front and back, up, top and the bottom, what's the part that is symmetrical to neck and shoulders?
Ovaries.
Ovaries, uterus. Got it? Right? What's that? Mm-hmm. So when you have stressed shoulders chronically, that will affect your hormonal balance. More in women, but in men also. So that's why so many women lately have these hormonal imbalances and wrong menstrual cycles and headaches and infertilities, you name it. Chronic stresses in our neck and shoulders will be mirrored in our reproductive area.
So if you're missing those female parts, it's even more so you're going to feel that in your shoulders.
Oh yeah.
So in order, if that's a chronic condition, then how do you get rid of that if you don't have any female parts?
Well, you can't really get rid of it completely, apparently, but you can balance it. That's the only thing you can do if you're missing it. And if you're missing all of it. Yeah. But sometimes you're missing only part of it, then other parts compensate. Well, scars, of course, prevent energy from flowing majorly. Or you need to work on that, for sure. So what I would suggest to do is to start working on your female or reproductive area like it's still there, and try to restore the energy flow in the area, and at the same time treating neck and shoulders, and see what happens. Should work. So this would be neck and shoulders in this situation for headaches is a paramount area for reasons. If it's a hormonal or if it's a blood circulation, it's still a very important area to work on. And don't forget, guys, base of the skull, right? To put your scanner or your laser on the base of the skull. Now, big reason for headaches may be also dental distress. We already know how to deal with that. We are not concentrating on that anymore. But you remember, TMJ area, right? Pterygoid areas, clavicle areas, areas over here. So you deal with dental distress because that can contribute. Next, for headaches, it's the place that hurts the most. We always work on the complaint. So when you have a headache, if your headache's in the temples, that's where you put your scanners and lasers. If it's in your forehead, that's where you put your scanners and lasers. So depending on where the headache is. For headaches, a great a little tool is the hair attachment for your scanner. So you can work on the skull. Laser doesn't have that, but it actually doesn't need it. So with the laser, all you need to do is to put laser in mode 2 for heart and brain, and just go that way, right? All over the skull. Watermelon. We'll call it this a watermelon technique because you're kind of making the moves like you're cutting a watermelon that way, right? And you do.
Hair loss.
Helps for hair loss, yeah. And also we do the same with the scanner, but scanner cannot reach the skull. So with the scanner, you would use the little attachment called the comb attachment, and slowly with scanner slower, just massaging the skull, but slowly moving in the same way, like you're cutting a watermelon. This would be the central point, and on the back would be the central point. So like a watermelon, you do that way, right? On the both sides.
That's for hair loss?
For headaches and hair loss, yes. Whatever issues with the skull. Now don't forget about 6 points on the face, of course, for headaches, right? And your third eye, because that's close to the place. Now, headaches sometimes depend on your ears. You can have the inner ear infections, especially if it's a dormant one. So what I would do if nothing there above helps, I would put scanner and laser right behind your ears, like over here. Okay? Right on mastoid, on this process. Now, going back to our headaches, what also helps with migraine headaches, it's putting your hands under cold and hot water intermittently. Like maybe for 30 seconds under very cold water, 30 seconds very hot. 30 seconds cold, 30 seconds hot. Or if you have your laser on scanner, especially scanner, put it on a pretty high energy level and do this for your laser. And do the same with your feet. It's called the socks and gloves in scanner therapy. You can do the same with the laser, socks and gloves. So you basically do just this with your hands and feet. And hands and feet under cold and hot water. Helps a lot.
Before we bought our Dove, we had been in touch with a woman who was using the old scanner.
Old scanner,
And she had a thing about getting your skin wet before you're using scanner. And you haven't really talked about it. So
No.
does it matter if you get wet before you use your Dove? Or
No, it doesn't.
just go for it. Doesn't
Just
matter.
go for it. It doesn't really matter. Sometimes we wet our skin to get better conductivity. If a person has very dry skin, then there's not enough conductivity for scanner even to start working. Then we suggest to wet the skin a little bit. But if skin is wet, there's not an issue. Even if it's a little.
Change the electrical for a couple of hours.
She said.
With the old scanners, of the old generation scanners, they suggested don't take any bath or shower 2 hours prior to the session or 2 hours after the session. Well, it will be better probably to work with the skin that has a little bit of chemicals on it. It's still better, but it's not such a big deal, really. Nice to do, but not necessarily. It's just when we sweat, we have these little chemicals which Judy was talking about on the skin, and then with the scanner we have microelectrophoresis, like kind of additional homeopathy effect to help your condition. But if you don't have it, you don't have it, so not a big deal.
And to guide the therapist.
Huh?
And to guide the therapist.
Right, and to guide the therapist, of course. Back to the headache. Laser, we would use mode 2 on the third eye, on our temples, on the back of our head, right over here. Helps a lot and fast. Considering that lots of our headaches are of the sympathetically dominant nature, so you can utilize some moments from our ANS balancing protocol. Especially my suggestion would be to go for the tailbone, third eye and tailbone especially at the same time, and stimulation of a tailbone as well as stimulation of pelvic nervous plexus in any way, shape or form helps your headaches a lot.
Wives' tale? You know the old wives' tale?
Yeah. Well, tell the old wives' tale, okay?
Wives' tale is a great way to get rid of headaches. It's orgasm.
That's right. That's absolutely right. And I didn't want how you see I was hesitating. I didn't know how to say that. But that was exactly what I was
I've been wanting to say it for about 10 minutes. I thought, how am I going to phrase this?
Yeah. And I'm hesitating, saying, well, how do I say that? But basically having an orgasm. It's one of the best ways to get rid of headache. Why, guys? Why? Come on. Parasympathetic nervous system. It's a great way of stimulate of parasympathetic nervous system. You sleep better. Your parasympathetic is up. It's pelvic nervous plexus. It's just right there.
Are you suggesting that she only do these protocols while she or before she gets pregnant?
No, I would suggest to do them regularly, or some parts of it. You don't have to go through the whole thing. Remember, treatment needs to be easy. So whenever you have time, do some elements of it which you found work the best for you when you do have a headache. So when you do, you obviously incorporate all of it because you try to get rid of it as much as you can. So you start with neck and shoulders, and you do your watermelon, and you do your temples, and you do your third eye, and you do your coccyx, and you do your adrenals, and you do your maybe solar plexus, whatever helps. Whatever you found that helps, then do it on a maintenance basis about twice a week, just to make sure that they don't come back. Because you found your key, so just keep going with your key, okay?
Typically what happens when we use the Dove or any of the devices is a person might have a migraine sometimes, say 2-3 times a week in real chronic cases. Usually after the first treatment they'll have a migraine then once every 2 weeks. And then the second or third treatment then once a month. Usually third or fourth treatment they may not have it for 5 or 6 months. And the more they do that, the less it comes there. It's a real normal phenomenon with the equipment. So.
And one little trick also, like socks and gloves and cold and hot water, massage your ears with the Dove. And it's such a pleasant procedure. You guys can try it right now. I just love that. It's just like this. Turn your Dove on and start massaging your little ears with the Dove. Helps. It helps with the headache, yeah, and just pleasant. And just do it.
There's so many acupuncture points in the ears.
Oh yeah, so lots of acupuncture points in the ears. Isn't that great? How, by the way, one condition that goes unnoticed also, injuries to a tailbone, to a coccyx. Injuries to a coccyx can create, right, Dr. Dennis? They can create a lot of headaches, which you can't really get rid of any other way, and you don't really know, because injuries to a tailbone disturb your energy flow majorly, and it often goes unnoticed. We dealt with headaches, sleep disorders. You already should know by now what we do with sleep disorders. So the fastest way to deal with sleep disorder, what that would be? Balance, sympathetic, parasympathetic. If you only have 3 minutes, what do you do? Tailbone, one, another. So right, because that's symmetrical, reciprocal points, right? There are reciprocal points. So if you have laser on the scanner, laser here, scanner on the tailbone, right? Then just one cycle. If you have 6 minutes, 3 minutes here, laser on a solar plexus, right? If you have 10 minutes, three pathways would go first, absolutely. 3 pathways, 6 points. Then you do solar plexus, and then you do this. Okay, so that's kind of routine before you go to bed. Now, if we have a little bit more of 10 minutes for our sleep disorders, let's say 15. Don't forget about neck and shoulders, right? Neck and shoulders, that's where stress sits. So you do neck and shoulders, maybe do little wings if you can. So massage neck and shoulders. At the same time, put laser where? You're massaging neck and shoulders with the scanner. Where is the opposite, the reciprocal point? Yep. So the laser, right, that's low abdomen, really, and it's improvement of blood circulation. It's also another reason for restless legs. And of course, check for your minerals, your mineral balance, right, because that can be one of the major reasons for your restless legs. So check mineral balance. Make sure you are taking what you're supposed to take: magnesium, kalium, calcium, all that trace minerals. And improvement of blood circulation for your legs, and of course you're dealing with your stress.
Have you found any?
Yeah, because restless legs, especially if the reason for this particular is the blood circulation, that's often is a reason for restless legs. You just guys, there are maybe many reasons for the same symptom, so you just try to hit the right one. So try, in order to improve the blood circulation, you put the laser here, run your scanner on the back of the legs to improve the blood circulation, or you try the minerals, or and see, and of course stress, definitely, and see what works the best for you. It's like with the headaches, because it's just a symptom of that masks many different disorders. Now, get through a very important protocol with you. And that's an immune modulation one, right? Because it's the second most important one, if not the first most important one. How we address the immune system. ANS balancing is the major, and immunity is the second major or the first major. no matter where we turn, we run into our low immunity or our inadequate immunity. Our allergies are our inadequate immunity because it's hyperactive immune system, and we have immunodeficiencies on the other side. So anyway you turn, you have immunodeficiencies or you have hyperactive immune system. And on either side, you will have diseases and disorders. And you have immunodeficiencies, and starting from our simple colds and flus, which happen too often, to such dreadful things as AIDS. Right? And you have our allergies as is probably the simplest way of, one of the simplest forms of hyperimmunity. And you have systemic immune disorders, autoimmune disorders on the other side of the spectrum, where your body starts attacking its own tissue. Right? So we have huge spectrum of immune disorders. And it's hyper or hypo, but it's not balanced. With immune modulation protocol, modulation we call because you will be influencing same areas, no matter if it's deficiency or if it's hyperactive immune system. But you will be addressing the same basic areas. And that's what I wanted to show you. So just you remember what kind of immune system, what parts in the body are directly related to immune system. We have our lymphatic system, and this is a major part of immunity. We have our glands, like our adenoids, our tonsils, our appendix. These are all glands related to immune system. Our spleen, our liver, there's a major part that are responsible for function of immune system. We have our digestive tract, our intestines, which are a major part of immune system. And we have thymus, which is extremely important for immunity. We have C7, which is our junction box and which is considered to be the immune-related vertebra. And of course we have lymph nodes all over. So these are major parts of immune system that need to be addressed when we start doing immune modulation protocol. Now quickly, what do we do? Deficiencies, hyperactive immune system. We'll be using fusion. If you are doing treatment of immune system and really want to treat the conditions, then you do your procedures 2-3 times a week. If strong boost is required, a very strong boost is required, then you need to do it daily. In the flu season, when you want to prevent yourself from developing a bad flu, 2-3 times a week, it's maintenance. If you already developed a flu, a cold, that's daily. Okay, you will be using laser and enhancers in mode 1, mode 5, mode 7. Depending on the condition, again, if it's just maintenance, you can utilize this just once for 3 minutes. If it's more than that, if you literally need to treat the condition, then up to 15-20 minutes altogether. So 5, 6, 7 cycles. Mode 1, 5, and 7. I'll show which mode when.
Oh, no, I didn't.
Now you will be using scanner and Cosmotic, or either or. Usually just default mode, and average between 25 and 30 minutes, but that's average, you can do less. You can do 5 to 10 minutes, and sometimes if you really need good treatment, it can last up to 45-50 minutes. And you will be using a blanket. The blanket is always a good idea. While you will be doing your protocol, you will be doing it under the blanket. Client wrapped in the blanket. And typically, just after the protocol, leave a client in the blanket for about 15-20 minutes. Step 1, you walk on the thymus. At the end of the day, I can pronounce that. And the second will be area just behind the right knee. So mode 2 on the thymus with the laser, and point behind the right knee. You can do with the laser or you can do with the scanner. So you can do both at the same time. Put the laser on your thymus and your scanner under the right knee, or the other way around. And behind the right knee, either mode 1, 5, or 7. Doesn't really matter. So the two first points, and it's right knee, not left one, right knee. Okay, so you're doing 3 minutes on each. Well, one cycle of one laser cycle, so 3 minutes of each. Now, with the scanner C7 junction box, 5 minutes. Now, what you need to do, and it's important, is to start treating lymphatics. So that would be lymphatic drainage. In stroking motions along the neck to your clavicles, you need to take your lymph and help relieve the lymph flow. And that you do with the laser or scanner or both. So you can do this, right? Like this, like this. Or you can do it with your scanner, or you can do it with your laser and scanner together. From your ears all the way down to clavicles, and after that, from your chest up to your armpits, like this, okay? Right over here, because that's where stagnation of lymph happens. You don't want that. You want good lymph flow, yeah. From the upwards, downwards, and towards. If you want, guys, if you have some lymph stagnation in the other part of the body, please do the same thing. It's just you go with the lymph flow, along the lymph flow. Like if you have swelling in your arms, you will be doing that way, right? If you have swelling in your legs, you will be doing from the bottom up, correct? So you try to improve the lymph circulation as much as you can, going along the towards the lymph nodes. With the scanner and the laser, both would be better. And in this situation, actually, laser can be placed right on the skin and used as a massage tool also. So you're pressing with the laser against the skin a little bit, so you mechanically improve the lymphatic circulation too, not just with the light. And the scanner, of course, well, it's a contact tool anyway. So that's the step 2. Now, don't forget about our important zone. It's the neck and shoulders. And with the neck, I'll give you one very simple and very powerful technique, which came from the scanner technology and scanner methodology, called the Pirogov's ring. Pirogov's, named after a very famous Russian surgeon. What this does, it works on the neck. That technique is on the neck, and it's a ring around the neck. So how you how you do it? You start on the back of the neck. You place your, in this situation, scanner. You can do it with laser too, but better with the scanner. Just right on the back of the neck for about 30 seconds. Just keep it there for 30 seconds. Default mode, just turn it on. And then slowly, slowly start moving your scanner all around your neck, just about with the speed as I'm showing now. Not detaching the machine from the skin, pressing a little bit, not too much, and making sure the machine is not going anywhere off the skin, all the way back to your neck. And again, as it reaches the spine, 30 seconds on the spine. And then start moving it backwards, same speed, same thing, backwards in a slow motion. And again, as you reach the spine, 30 seconds on the spine. This is considered to be one cycle. Clockwise, counterclockwise, it's a one cycle. So you do about 3-5 cycles depending on the condition you have. And you can do it with a laser also, or with a scanner, or both. Neck has a lot of structures that are immune related. They have sympathetic, parasympathetic nervous system, blood vessels, sympathetic nervous ganglia, vagus nerve, and lots of lymphatic nodes. So you are influencing a lot of immune-related structures. One of the best, simplest, and the best techniques to do in any situation when you need to modulate the immune system. Even when you have a simple cold or flu, that's probably the best thing you can do. Okay. Now you do the ring. Now you continue on the neck and shoulders. Again, as we already know how to do that, right? We can do little wings too. That's how we do little wings. Remember where we put the machine, right? So not reminding you. Continuing on our digestive system. Liver, kidneys, large intestines. Scanner, laser. Laser right on the liver, right on the spleen, right on your kidneys and adrenals. And what you can do with the scanner, you can stay on those areas, or you can start doing spirals on the abdomen. I will show you later, the day after tomorrow, how to do the spirals on the abdomen, or 5-point star. You can do that too. So you will be working with the scanner on the abdomen and with the laser on all these areas. Okay, so that's for immune system. And the final touch in this protocol is the influencing of the triple theta meridian. Oh, actually, not that's not. It's one before the final. So triple theta, that's how it goes. That's the. Can you see, guys, on the diagram, right? That's the flow of a triple theta. You can do it with the laser or the scanner. Yep.
In the meridians, it's called the triple warmer. Is it the same thing?
It's the same. Well, and the last point in the immune modulation protocol, testicles, ovaries, very important. One of the best spots. Even if you don't influence anything else, if you just do testicles and ovaries and the C7 and the thymus, you will have a good influence on the immune system. So, well, as we said with the ANS balancing, right? Tailbone, third eye, right? With immune modulation, that would be ovaries, testicles, thymus, C7. If you have only 5 minutes, that's what you do. Yeah, C7, the seventh cervical vertebra. So if you need immune boost real fast and you have only 5 minutes, you do C7, you do thymus. They are reciprocal. If you have a little more, add testicles, ovaries, and all the other parts of the protocol if you have more time. My suggestion next would be going for the digestive system. Even though it looks like it kind of doesn't have that direct connection to the immune system, it does. So my suggestion next thing to do would be to do the spirals or lasering digestive system. That I would do. And the next thing is the Perigob's ring, which requires about 5-10 minutes, but the ring would be one of the most powerful things. So that's our immune modulation. No, that's not. That was weight loss. So that's our immune modulation protocol. So when we would use that? In any situation when we need boost of immune system or calming it down. You would use the same areas, same time, same modes. It's the modulation the body will choose. So same areas depending if it's hyperactive or hypoactive immune system. Mm-hmm.
Like if something with rheumatoid arthritis?
Absolutely. Rheumatoid arthritis is autoimmune disorder. Any autoimmune disorder requires that.
Like every day you would have
Every day. A systemic autoimmune disorder requires it every day.
And you think you'd spend like, because it would take an hour to do
Full-blown protocol about 40 minutes. 40 if you do every step of the way, about 40-45 minutes.
On somebody like, I have really bad rheumatoid arthritis now. You think I can for 40 minutes?
No, you don't have to do that. Like I would do it about 3 times a week, full-blown one, and the short version in between. Like a few points out of that, you choose what's the most important for her. And if she has a certain joints, I would add one or another, but only 1 or 2. I wouldn't do all the joints. I would only the most important one, only 1 at a time, or maybe 2 at a time, not more. Yep.
I had touched a foreign substance that was a blue that came over from China. It was packed in some type of slime type of thing.
Okay.
And so I touched it, and now all I do is break out in hives, big welts. Actually, they're welts, and they don't go away. I've had it for a year now since I went to this auction.
Oh God.
And will this be?
Yeah, the body cannot process it yet. It still has that stuff inside.
That's what I'm
So so you need to do that in order for the body to get rid of, because it's obviously hypersensitivity to some substance which is still there. You need to clean your liver. You need to clean your kidneys, right?
Right.
To get it out, but also to dump the hypersensitivity. So that protocol will help you a lot. Okay, see guys, by doing what we're doing, we're also answering a lot of our diseases and disorders, right? So that's why we're doing it that way. So, okay. Thank you.